Good afternoon and good morning. Thank you everyone for joining us today. I'm going to ask if folks can please mute themselves. Thank you so much. So welcome to Healthy Smiles, Healthy Lives, Practical Dental Care Tips for Dementia Caregivers. This is a program co-hosted by the Alzheimer's Association, Northern California, Northern Nevada chapter, and the New York City chapter, with our guest speakers from House Call Dentists. So just some quick housekeeping. I please want to remind everyone this is a session that will be recorded. So if you prefer to stay off camera, please do so at this moment. We do ask for everyone to mute themselves upon entering. We ask for you to also please put your questions in the chat. We will have a moment to answer questions at the very end. So again, thank you for joining us. Please make sure you stay muted. We have colleagues from both chapters here to answer any questions you might have on the chat. So as the size of the US population, age 65 and older, continues to grow, so too will the number and proportion of Americans with Alzheimer's or other dementias. By 2050, the number of people aged 65 and older with Alzheimer's may grow to a projected 12.7 million. So our work now is more important than ever. We understand that everyone's journey with Alzheimer's is very different, but one thing that we know is that it can be very challenging. It could be isolating. The Alzheimer's Association, we're leaders in the area of global research, driving risk reduction and early detection and maximizing quality care and support. More than anything, we want to ensure that our caregivers, community members, individuals with a diagnosis feel supported and connected. So just to make sure that we're on the same page, our mission references Alzheimer's and dementia, and while these terms are often used interchangeably, we want to make sure that we talk about each one. So dementia is a general term for the loss of memory, thinking, language, problem solving, and other abilities that are severe enough to interfere with daily life. Dementia is not a single disease, it's an umbrella term, like heart disease, that covers a wide range of specific medical conditions, including Alzheimer's disease. Alzheimer's is the most common cause of dementia. Alzheimer's is a progressive disease where symptoms gradually worsen over a number of years. And while age is the greatest known risk factors, individuals under the age of 65 can be diagnosed with Alzheimer's. And this is known as younger onset Alzheimer's. So dental work can be hard for a person as dementia worsens. Alzheimer's and other dementias cause changes in the brain, and these changes make it hard for the person to understand what's happening during a dental visit, as well as taking care of their dental hygiene at home, which is, again, one of the reasons why we're so grateful for our guest speakers joining us today for this special program. So, as I mentioned earlier, we know that dementia care is a complex maze, and navigating this maze is difficult and often frustrating for people living with Alzheimer's or other dementias, as well as their caregivers. At the Alzheimer's Association, we provide free care and support for those affected. Please know that our 24/7 helpline, 800-272-3900, is a free service where you can talk to dementia care experts and get confidential emotional support, be connected to local resources, and receive information in over 200 different languages. It's okay if you don't know where to start, just give us a call and we'll give you a guide from there. So now I'd like to turn the presentation over to our guest speakers, Dr. Goodman and Dr. Gupta. Thank you so much for joining us today.
Can everyone see our screen here with the presentation?
Hello, everyone. Thank you for joining us today. My name's Dr. Gupta. Today, we'll be discussing practical dental care tips for dementia caregivers and how to have a healthy smile so you have a healthy life. A little bit about me. So I graduated from the University of Pennsylvania, and I got my dual degree. So my first degree being in dentistry and my second a Master's of Science in Higher Education. I was really passionate about combining my love for dentistry and education, and I really enjoy disseminating information on how to take care of your oral health. While I was in dental school, I participated in the Vulnerable Populations Clinic as well as the Care Center for Persons with Disabilities Clinic. And been with both of those experiences, I was able to help patients that might not otherwise receive the dental care that they deserved. I then moved to Florida, where I completed an advanced education in general dentistry at the Orlando Veterans Affairs Medical Center. And so through these experiences, I was able to culminate how to provide individualized, compassionate, and quality dental care. And then I moved to New York, and I've been with the Blendy Dental Group, House Call Dentist, for about a year and a half now.
All right. Hi, everyone. Thank you so much for having us today. I'm Lindsay Goodman, and Dr. Gupta's over in New York City. I'm over in San Francisco. She has a few more letters after her name and degree, even though she's younger. And it's been a pleasure working with her, even though we're on opposite coasts. We consult with each other a lot on different cases. I went to dental school in Boston. And then I did a residency program in New York City because you're required to do residency, which happened to be in a hospital. So I actually fell into treating special needs and dementia patients. It was not this passion I had when I was young, but when I fell into it, it gave me a lot of fulfillment. So now I'm working in our San Francisco office, primarily doing house calls and hospital cases for special needs dementia.
Hey, so today we will be discussing a few different things. So first, the link between oral health and your overall health. Second, the diseases related to the mouth. Of course, it's not a comprehensive list. That's 4 years of dental school, but we'll give you a little idea. Next is resistance to oral care and some successful tips to provide oral care. And then finally, how the dentist can help. So to get started, why is oral health important? So oral health is not about having straight white teeth. Oral health is about ensuring you have a healthy bacteria flora, adequate levels of bone, and teeth that aren't painful when you eat or drink. And your oral health actually affects your total body health. So when you have good oral health, you have a positive self-image. You're confident, you're happy to smile, you're happy to speak. So therefore, you're comfortable while eating and speaking, and your overall general health improves. Versus when you have poor oral health, you're in this constant state of moderate to severe pain. You're cautious of what you're eating and drinking. Maybe having cold water triggers some pain, and so you're not eating the way you should be. Sometimes you have difficulty speaking or swallowing. And overall, that can result in emergency dental care, which I know most people can agree is a very unpleasant experience. And so that's why we want to err towards good oral health, because with poor oral health, you have a diminished quality of life. So something Dr. Goodman and I love to do are pop quizzes. So the first question is a true or false. You guys can type your answers in the chat box. So true or false, co-occurrence of diabetes and dementia have an additive effect on cognitive impairment. And this is not graded. Great. Okay. A lot of people know their stuff. I'm glad. So the answer is true. So poor oral health is linked to systemic diseases. So together with the bacteria that form cavities and gum disease, your overall health declines and you're more susceptible to stroke, pneumonia, heart disease, and diabetes. Specifically with diabetes, there's a bidirectional relationship between diabetes and periodontal disease. So as your glycemic control worsens, so does your periodontal disease, and vice versa. If your periodontal disease worsens, so does your diabetes. So it's important you take care of your oral health. And then in most recent studies, there's actually been studies that's shown that tooth loss is associated with cognitive impairment. So meaning that with more tooth loss, there was a 48% greater risk for developing cognitive impairment and a 28% greater risk for dementia. So I'll switch it over now to Dr. Goodman to talk about some of the diseases we see in the mouth.
All right, we get to the fun stuff. If you're here today, I just want to say this is a difficult topic. I think dental care for dementia patients, it's lacking, and that's why we're here today. So if you feel lost or you're not sure, don't feel guilty. That's why we're filling in here. And you may even learn some tips for yourself outside of someone you care or love for. So let's start with diseases related to the mouth. Most of us have had cavities, so you may know what that is. We'll talk about abscess, gum disease, periodontal disease, which 50% of American adults have. Many don't know they have it, and bruxism or grinding. So dental decay, very common. We tend to get these when we're kids, having sugar, candy. Essentially, how the disease process works is, let's say you eat sugar, bacteria metabolizes sugar. So they eat the sugar and they poo out acid. That's not the technical term, but that is what happens. And it softens the tooth structure, creating a hole, like a black or brown hole in your tooth, which becomes soft. Now, when these decays are small and even sometimes big, you may not feel them. So that's why it's important to see a dentist and minimize sugar. So, pop quiz. Which of these beverages are best for the health of your teeth? And Dr. Gupta, if you could help fill me in on some of the answers you see in the quiz box. Milk, bubbly water, tap water, or orange juice. Let us know what you think is best for your teeth.
Most people are saying C, tap water.
Okay. Well, you're outsmarting us. Tap water is the best for your teeth. If you look here, this is a pH scale. The lower the pH, the more acidic. So as you can see, a pH of 1 equates to battery acid. As you go up, it's more neutral. Water is right in the middle where you want your mouth. Water also has fluoride in it. Some people may think, or a common misconception is that milk is really good for your teeth. But actually there's lactose in milk, which is sugar. So with milk, you can still drink it, but when we talk about sugar in beverages like soda, orange juice, it's all about frequency more than the amount you drink. So if you sip on soda like Mountain Dew throughout the day, the pH levels in your mouth stay low and acidic, and that's what causes cavities. Whereas if you drink that soda or milk quickly in one sitting, it gives your body time to recalibrate and become neutral again. So next would be abscesses. That's if you see someone with a big swelling or you have an emergency root canal, you're in a lot of pain. It's typically from an abscess. And what happens there is usually the cavity we talked about that's going through the enamel. It gets to the middle of the tooth, and in the middle of the tooth is your nerve and blood vessels. And that's why infection occurs. The inflammatory process of your body sends cells to that area, causing a swelling, and it can be dangerous. So if you see in the photo there's a swelling underneath the chin. We have to be careful of that blocking the airway. This is an example here of a nursing home here in California where someone actually died because of an untreated, undiagnosed dental abscess. So we do need to look out for abscesses, which usually are seen as swelling in the mouth. But sometimes there is no swelling. So seeing a dentist is good. Okay, next we're going to go to gingivitis. That's when you see someone typically with red gums, or if you floss and it starts bleeding. And I think what's interesting about the mouth is, if your arm is bleeding, you're going to attend to it right away. But for some reason, when it's your mouth, it's almost normalized. And maybe it's because it's so common. Maybe it's because your lips cloak your mouth and you can't really see what's going on inside. But it is a disease process. So gingivitis is when the gum around your teeth is very inflamed. When you go to the next level after gingivitis, it's called periodontal disease. And if you ever heard the term long in the tooth, or someone has horse-like teeth because they're so long, it's because they've lost the bone around the teeth. So the gum is overlying the bone. The bone is what holds your teeth in your mouth. So I like this little meme. When was the last time you flossed? Bro, you were there. And this is common. You go to the dentist, they ask you if you flossed. We know when you're lying, and there's a reason it's important. It's to prevent periodontal disease. And the way that disease process looks, if you look in the cartoon here, in the diagram, you can see that the bone has been lost around the teeth here. I don't know if you can see my pointer. And that's what's holding your teeth in place. So now if you look at the x-ray here, there's this black, and that's bone loss around the tooth. So you can guess what happens. That's how your teeth become wobbly and loose. Recession occurs, so you start to see exposed root structure. There's typically tartar and plaque. What you might see the white stuff on people's lower teeth, that's tartar. Inflamed gums, bleeding gums. And our biggest concern with the dementia population is, since the teeth are loose, now what happens when those teeth fall out? Does that go into their hand? Do they swallow it, or do they aspirate it? So that's our biggest concern, is aspiration when it comes to periodontal disease. And even the bacteria, if you don't aspirate the tooth, you can aspirate the bacteria that's sitting around the tooth structure, which causes pneumonia. So if someone has pneumonia, it's not necessarily just from a UTI. Oftentimes it is dental related. Final disease process, I promise, is bruxism. The same thing as clenching or grinding. A lot of us have it, especially if you live in New York City. I'm guessing it's a stressful place. I used to live there. Not hating on New York. I still love New York. But you may have heard the term TMJ. That's a misnomer. TMJ just means temporomandibular joint. TMD is the disease. So if someone says, "Oh, I have TMJ," they really mean I have TMD, temporomandibular disorder. So constant grinding of the teeth, it causes attrition. So your tooth enamel, dentin starts to go away. And we especially see this in dementia and Alzheimer's. 30% of those with frontotemporal dementia have it. And a lot of the medications treating Alzheimer's cause, as a side effect, bruxism.
So now, after getting a good idea of what can be seen in the mouth, here are some of the signs to visit the dentist. So if you notice your loved one has bad breath, maybe their gums are bleeding when you're flossing or brushing, if they're refusing to eat or smile, if they're wearing dentures and the dentures do not fit, or there's redness of the gums, there's sore spots in the mouth, if there's loose teeth because of periodontal disease, or if they just haven't seen the dentist in over a year, it's always a good idea to have an examination just to make sure there's no disease processes starting. We always want to catch things early. And so on to another pop quiz. True or false, dry mouth is caused by old age? Dr. Goodman, I think we need to come up with some harder questions next time. Everyone's getting here. So great. So let's talk about the causes of oral disease. So the first and the obvious is poor oral hygiene. Someone that may have never had a cavity from their 20s to 60s, they may have never gotten one, but now once they are diagnosed with Alzheimer's disease, they're not able to brush their teeth as often. They're not able to floss as often. And so poor oral hygiene contributes to cavities development. There's teeth clenching and grinding, like Dr. Goodman mentioned, diabetes and the bidirectional relationship with periodontal disease, smoking, poor nutrition, so snacking or drinking that Mountain Dew throughout the day, and then medications. We'll get more into this, but 89% of geriatric patients have xerostomia, also known as dry mouth. But the one thing I want to highlight on this slide is that age is not a cause of oral disease. So just because you're getting older doesn't mean that you should be losing your teeth. It's all about maintenance and all these different factors to keep your oral health healthy. So on to medications that can cause dry mouth. So there's hundreds of medications. So high blood pressure medications, antidepressants. There's so many medications that have a side effect of dry mouth. And taking multiple of these medications puts you at an exponentiated risk of dry mouth. And dry mouth is such an uncomfortable feeling. It makes it difficult to speak, to chew, and to swallow. And so you can see someone that's constantly sipping on water, and their mouth just always looks dry. And it increases your risk of cavities as well because now your sugar, your food isn't being washed away by your saliva. Dr. Goodman will go over some of the preventative techniques.
Sure. Um, So I think number one with dry mouth, when I go into care homes, often I'll look bedside and there's a cup of juice next to the person. A lot of dementia, Alzheimer's are craving sugar and carbohydrates, but we want to try and lean towards water, even if it means diluting the juice to eventually supplement for water. So that's number one, is sipping on water throughout the day. And then some products I recommend, definitely biotin. If you go to Walgreens, Duane Reade in New York, go to the dental section, you can find biotin. There's also gum that helps prevent decay and stimulates saliva. Anything that's sugar-free and has xylitol. So now let's go into at-home care. We can all admit this is very, very difficult. So anything we say, it's all person dependent. There's no right answer for every person. So we're going to give tips and then the person best to figure out how to treat them. And so that would be the main takeaway here. So for everyone, in an ideal world, we want to brush twice a day. We like to say the bugs come out to play at night. The best time to brush is right before bed and right when they wake up in the morning, because in the evening, your tongue, your saliva, it's not doing the work to push the bacteria out of the way. So that's the best time to do it in an ideal world. You want to brush for 2 minutes, circular pattern towards the gums, and make sure to get all parts of the teeth on the outside, the inside, all 4 quadrants. If you're right-handed, it's easier to focus too much on the left side. You got to turn the wrist, get the other side. I think electric toothbrush like Oral-B and Sonicare, it takes the thinking out of it. We all use it because it does a better job than most humans can. Make sure it's a soft toothbrush. And this goes for those listening too, not just for the people you're taking care of. And then we also recommend fluoridated toothpaste. In general, if you see an ADA symbol on the dental product, that's a good sign. That's the American Dental Association. Those with swallowing, aspiration risks, a pea-size amount of toothpaste is good. So you can see some tips on the upper right for those with dexterity issues. Dr. Gupta in a little bit is going to talk about autonomy. So if we can continue to have your loved one brush their own teeth, that's wonderful. And these are some tips for dexterity. You can see you can grab a tennis ball, poke a hole in it, and put the toothbrush in. These are some tubings I got off Amazon. We'll send you the links for those. And you take a toothbrush and you stick it in the hole, and now you have a good grip for that. Rubber band is also another option. And then on the lower right there, you can see the tubing, but also there's the number 30 Oral-B soft toothbrush. This is great for those with trouble opening, especially. It's a smaller toothbrush head. So sometimes trying to get the head way back in the back of the mouth is difficult to fit. This one is a little bit smaller. It's compact size to try and reach those difficult areas. Next is flossing. I would say 99% of the patients I'm seeing with dementia aren't flossing. And it is a high bar. And so no one's going to say, you definitely, if you're not flossing, you're doing a terrible job. No one is saying that. It is extremely difficult depending on the person. These are some tips to try if you can. So one would be this Listerine Ultra Clean on the left side here. It has a long handle so you can get in there and floss. And again, flossing is helping prevent periodontal disease, mainly outside of cavities. When people are older, it's mostly the gum disease we're worried about, and we want flossing to happen. There's also proxy brushes, which you can see here. You don't have to go over the tooth or behind it. It's from the outside. You just push it between the teeth to help floss. And finally, you can try using a water pick with the caveat if they're swallowing precautions and aspiration risk, then you may not want to. But if that is an option, you could try doing that in the shower while they're being bathed, just to get in between the teeth. Because a water pick, though it's not as good as traditional floss, it's an adjunct and it's better than nothing. So going into mouthwash, I like the alcohol-free for most with memory care because of the sting that alcohol can cause. It can be triggering. So alcohol-free is a little more comfortable. And then you want to look at the label and see, is this for cavities or is it more for gum disease? There'll be a label on the front of the mouthwash. So if the person has more of periodontal disease, you want to do the gingivitis fighting. If they have more cavities, then you want the caries preventing mouthwash. Or you can mix both and do one at night, one in the morning. For those that are unable to rinse and spit, you can take one of these sponges. You see a photo here, dip it in the mouthwash and just coat the teeth and just let it be. And then the other thing to check is when swallowing becomes an issue, you'll often find in this area, I'll show you, right in the pocket, there'll be food lodged in there and stuck. And this is very, very easy to miss because when you're brushing, you may not look in those pockets, but food gets stored there. And when it sits, the bacteria festers and cavities can happen. So you can use these sponges or even a gloved finger to help just dispose that excess food that's sitting there. So swallowing and spitting concerns, this is probably a popular question. You can use an emesis there if you can't get to a sink, just to have the person sit up. They should be leaning forward, tilting their head forward so that the water comes towards the front and not towards their throat. There was another question I saw before we started, which was how do you get them to spit into the sink? One tip we have is to put a bright colored washcloth at the bottom of the sink, and that can be their target. But again, it's individualized. You have to see what works for the person. And then just use very little liquid. So like we said before, pea-size amount of toothpaste. You can brush and you don't have to rinse, or you can just, if it's a pea-size amount, leaving it is okay. That'll help prevent cavities. And then we'll briefly discuss denture care. The first thing is, do they have a denture? Sometimes the person doesn't even know that there is a denture in the mouth. It's confusing. You're not dentists. So the number one thing I say is if you're not sure, find out who their last dentist was, give them a call to find out if they have any removable appliances in their mouth, because this can be confusing. If they do have a denture, it's something that should be taken out every night. So compliance is important here. And often we find dementia and Alzheimer's it can be difficult once you're in the end stages to create dentures or utilize dentures due to compliance. But if they're in the routine and using the dentures, just make sure to take them out in the evening. Never use hot water. Keep them hydrated at night. And there are denture brushes to help clean the debris. Very important, we see this all the time too, is dentures get thrown out, especially in care communities. They're put into a paper towel during mealtime or at night. Cleaner comes in and throws it out, and now we have to make them a new denture. So a designated box that's labeled for them is super important. And then if adhesive is being used or denture paste, to make sure you clean that off the denture every night, and also the residue that's on their mouth, typically on the palate. So next pop quiz question. If you can see that the person you are caring for has their natural front teeth, then they are definitely not wearing a denture. True or false? The feeling they're going to get it correctly.
We got a lot of people saying false, Dr. Goodman.
Okay, I guess the definitely might have given it away. Very definitive. This is a photo of a partial denture. So there's all different types of dentures there, and you do not have to know this. Again, it goes back to just talking to their dentist if you're not sure. There's dentures that are screwed into implants, and then there's removable dentures, and we're really just talking about the removable ones. This is an example of a partial denture. So they typically have clasps, as you can see, and they just cover some of the missing teeth, whereas there's other natural teeth in the mouth. So now Dr. Gupta is going to be talking about maybe what most of you came for is what do you do if the dental care becomes a challenge?
I think everyone has a good spiel of how to take care of your mouth, but a lot of our loved ones refuse the care, and we've categorized a few of the reasons why. So the first can be self-esteem. Most people have been brushing their teeth by themselves since a young age of 4 or 5, and so having another adult that's usually younger than them doing it for them, they can feel babied or bossed around or even embarrassed that now they require their help. Someone may be feeling self-conscious about how their mouth appears, or they might not be feeling connected enough to the caregiver to allow them to look inside their mouth. Well-being, they might be fearful of pain or discomfort, and they may not understand the procedure. They might not know the type of flossing technique that you're using. And then it can also be physical. So they might feel that having a toothbrush in their mouth is a violation of their personal space. They might be having just in general dental pain from broken teeth, or they could just be simply tired at nighttime and not want to brush. So here are some of our tips for each of those categories. So for self-esteem, so if they're feeling like you're babying them or they're being bossed around, consider letting them utilize the toothbrush and invite them to brush their own teeth. And even you can brush your teeth in front of them so they have a live demonstration. Give them the opportunity to choose. So maybe you can say, would you like strawberry toothpaste today or would you like mint toothpaste today? I would not recommend giving too many options. Maybe keep it limited to 2 or 3 so you don't overwhelm them. Give them a reason to brush their teeth. Sometimes people feel that, oh, like I'm just going to bed, no one really is looking at me. But, maybe give them a joke that, hey, that cute Mrs. Betty down the street, don't you want her to look at your nice smile and there's a bunch of spinach in your teeth? So maybe showing them that there's something stuck in their teeth and encourage them to get the food out. So autonomy and partnership. So the big thing is in this case that you want them to feel like they can do things by themselves, that they're not fully relying on someone else, but that you're there to help them. So maybe you can remind them, hey, like, I think you missed the right side of your mouth. Let's go back and clean that, or I'll do it with you. And then again, demonstration and improvement. So brushing your teeth while maybe they're brushing their teeth and saying you missed this spot is a good way to encourage them, but also maintaining their autonomy. There's a technique called hand under hand where you are placing your hand with their hand and you're holding the toothbrush, but they're still able to move their hand back and forth. So they feel like they're brushing their teeth and you're still providing that partnership. Um, if they're feeling self-conscious, so they're not really happy with the appearance of their teeth, the first thing is just make sure they're in a comfortable private space where they feel safe. So sometimes bathrooms have very bright lightings. Maybe they don't want to be in that environment, somewhere where it's more dim. Make sure you establish a relationship with them. I know sometimes caregivers aren't there, they rotate often, and just make sure to introduce yourself and try to find a similarity. Tell them that, hey, I have to brush my teeth every day too. Why don't I brush with you? Or I've had a cavity in the past. You know, reminding them that you're also human and that you have to brush your teeth. And always, of course, words of encouragement. So reminding them that they're doing a good job, that they're helping themselves, that you're proud of them. These are all things that'll make them feel better about themselves and about cleaning their teeth. If well-being. So always first thing is gain permission. So ask them if it's okay to brush their teeth. Um, Sometimes you don't want to be too fluid and giving them too many options and the ability to say no. So you can say, we are going to brush your teeth right now. Are you ready? Let's do it. Are you excited? Things like that. And then making sure to slow down and explain what you're doing. Brushing can be intimidating sometimes, so consider showing them the toothbrush, letting them feel it on their finger. You can rub it. That way they know what the texture is in their mouth, and always taking breaks. So maybe you do the upper right and they need a few second break. Give them that extra time. If they're a little nervous, consider giving them a comforting object. We usually like objects that they can like squeeze, something like a stress ball almost like, and then developing a routine. So trying to have the same timing for brushing and flossing. That way it's, you know, almost routine for them that once I have dinner, I'm going to brush my teeth. And you're not giving them that opportunity to watch TV and relax. And then they don't want to brush their teeth because that happens to all of us. And then finally, physical. So there's a lot that goes into physical. Dr. Goodman mentioned the toothbrush type. So we always recommend a soft toothbrush, but consider the color of the toothbrush. So maybe they like bright colors like green. That's a good one to use, giving them that option. Consider the texture, like we said, soft. And then electric versus manual. Some people have never used an electric toothbrush before, and so it might be a new sensation that they're not comfortable with. And so using a manual toothbrush is still fine. Toothpaste flavor, we've seen that as people age, sometimes they don't like mint flavors anymore, and they prefer that bubblegum strawberry-like flavors. So also experimenting with other flavors. Location, like I said, sometimes bathrooms have very bright lights. So maybe they would rather do it, brush their teeth in their favorite couch instead, and then use that emesis bin for them to spit into. Timing a brush, like I said, we don't want to let them have dinner, watch TV for 2 hours because most people get lazy and don't want to brush their teeth. They want to go to bed. So thinking about that. The temperature is a big one that we have to consider. Most people like to brush their teeth with cold water, but if someone has a cavity or a broken tooth or even recession, that cold water can really cause pain and discomfort. And so you might want to try towards warm water. Music is another great one that I almost always have to use when I go see my patients in their home. Consider Brush DJ. It's kind of like an app that has a bunch of songs that are all 2 minutes long. And it's a good way to just provide background while doing the task at hand. And then finally, of course, a dental evaluation. If they are in genuine pain from their mouth, it won't go away, and it's important to have a dentist come check so that they are comfortable eating and drinking and brushing. So now we're going to share a video of some of the tools we use when we go do house calls and do cleanings. The first is a cheek retractor. This is very helpful to visualize the oral cavity and something you can just get on Amazon. Let's see if we can play it. Dr. Goodman, and here we have. And I'm going to show you how to use any tools. Making it easier to clean teeth. Sometimes it's cheap. You can get this like keep us and these show the bigger. And what I do is I usually take the bigger end, cut it as well as snake. This will just go right.
Sorry.
And we have one other video. This is a mouth prop that we love to use this. It's basically like a styrofoam that the person you're brushing their teeth, they just bite on and it's really soft. I think there's some difficulty hearing the videos. We'll make sure to send the videos out after the presentation too, so you can review it later.
Volume up. The next tool I have here is an open wide mouth press. Information for getting that. All right, the next tool is. All right. I will stick to dentistry and not acting here, but thank you for watching those. I hope that is helpful, especially if you get a copy of the video, especially when it's challenging to get inside the mouth, which we all know it can be as dementia progresses. Now we're coming towards the conclusion of our presentation soon, and I just wanted to talk about actual dental care. There's different approaches. Usually before we even see a patient, we've talked to the family and we've talked to the physicians. Now that conversation with the physician is so important to determine, life trajectory, precautions we should take, because you could go the palliative route, especially when someone's near end of life and hospice, really to keep them comfortable. That's the primary goal, versus restorative care. Someone has 10 years to live, they still love eating, then we may go a more restorative route where we restore teeth that have cavities with crowns and different replacements so they still have full function. I'm going to just show you a couple examples. This case was a house call. She's 100 years old. We went to her home in the Bay Area in a care community. And when I got in there, she was smiling. She thought she was in Hawaii, and we just rolled with it. We came in, she said, "Aloha, baby." And we dimmed the lights. We put luau music on, took full x-rays. She was totally cooperative. You can see in her mouth there are a lot of disease. You see the tartar, you see the inflammation. But given our conversation with her family and her doctors, they said just take care of any active infection. So in that single visit, we took x-rays. She had 4 abscesses, and I was able to take out all 4 teeth bedside in Hawaii, just under numbing, local anesthetic. And that was it. If she's ever in pain again or needs anything, we're here for her. So that's a palliative case. A more restorative case here. This guy, he was in his 70s. His wife actually called us for a house call because she noticed his front tooth broke off. And she was more into vanity and looks, and she still cared for that for her husband, and we can respect that. So we went in, and as you can see, that one broken tooth was really a window to a lot of dental problems, infection, decay that was going on. And at this point, he was very non-cooperative. His dementia had progressed. We couldn't get x-rays at that visit. So I think the bigger point here is that as soon as there's a diagnosis of dementia or Alzheimer's, it is important to get a dentist in and proactively treat before it becomes too difficult to treat. And I can tell you, most dentists have no idea or no training on how to manage this type of case. So in this situation, what we did was, because his teeth had progressed so far into decay, we used our hospital privileges, where we did sedation dentistry. And as you can see here, we were able to restore not only some vanity for the wife, but also function. He still loves eating. His doctor said he has probably a good 5 to 10 years left. And we did fixed bridges. So that's different than dentures. In this type of scenario, you want something that cements in and doesn't go in and out of the mouth due to compliance issues, as well as risk of aspiration. So just some resources for you. I have Julia here, who is our head of strategic partnerships. Thank you for being here. And she'll talk about us a little bit. But people are located everywhere. So just to give you a general overview of where you can find resources, I mean, you're always welcome to reach out to us. But the SCDA, the Special Care Dentistry Association, me and Dr. Gupta are members. There's a Find a Dentist link there, where no matter where you are, you can try to find someone with some experience in this realm, because it is hard to find a dentist who cares for this population. In California, there are special hygienists who can come to the home without a dentist to do that initial exam and cleaning. And that's an RDHAP. I also put a link to the website there to find a hygienist that can come to the home.
Okay, so just a little bit about us. So again, we are house call dentists, so we come to you. We provide all the dental care in the comfort of your home. So the exam, the cleaning, the x-rays, any restorative work, crowns, bridges, extractions, fillings, we do it all in the comfort of your chair. And our team is on call 24/7. So if there's ever a dental emergency, you can also give us a call. Just here's some pictures of our portable equipment. It's almost like we're bringing like 2 or 3 carry-on size suitcases with us. And again, everything is digital. And so we do transform the home into a mini dental clinic. And then we do have a few options for how we provide care. So of course, one-on-one in the comfort of the patient's home. We also do have a typical brick and mortar clinic, one in San Francisco and one in New York. And then we also really enjoy providing education. So one thing we've mentioned a few times during this presentation is that everything is individualized. So when we go to the home, it's great because we can actually see which toothpaste the individual's using, which type of toothbrush, and we can give tips and techniques that are individualized. If you are interested in our services, here is our information. You can give us a call or look at our website. And that is our presentation today. I know we're short on time, but we're happy to take any questions.
Thank you so much, Dr. Goodman and Dr. Gupta. This was an incredible presentation. Um, I learned a lot for myself as well as to support our caregivers. So we do have a couple of questions, so I'm gonna go through them and read them out loud. There was a question, and Dr. Goodman, you did share some techniques in terms of encouraging someone to spit. The question reads, my husband has advanced Alzheimer's and is immobile in a nursing home. The dentist in the nursing home told me he couldn't work with my husband because he couldn't open his mouth and couldn't spit. I'm going back to be present with my husband because I think I can get him to at least open his mouth. Do you have any additional suggestions about how to proceed with this issue? And is this experience the norm?
Go ahead, Dr. Gupta.
I didn't say, I can give some suggestions for the opening mouth. Definitely, I understand it is difficult. They might not fully understand what you're doing. There's a few places of the face and mouth that you can touch that trigger someone to open their mouth. So I'll do it on myself, is the cheek and the lip. One trick I like to do is actually put like Vaseline or chapstick on the lip, and usually people slightly open when you start to do that. And then utilizing the mouth prop to keep them open. And before you put anything in their mouth, always show it to them at an angle and position that they can see, so that they're not fearful of what's going into their mouth. Anything else? Sorry, did I answer the question?
Yeah, no, I mean, it's a really challenging thing. And so with that dentist, if you could be there, maybe you have been for the appointments, to try and give some tips. Not everyone likes medicine to intervene, but oftentimes we do prescribe Ativan or some sort of anti-anxiety medication. So it's a little bit easier to get in there. And then if all else fails, you can call us, because we do, sometimes you really can't get in there. But it sounds like you can a bit. It's just teaching the other person how to do that and having enough time to be able to do that.
You, Dr. Gupta and Dr. Goodman. We have another question. The question reads, mom has to get two cracked teeth to get extracted. She was antibiotic and currently is fight, and then it's CDIFFICL.
C. difficile.
Yes, thank you. What type of anesthesia should the dentist do? I don't want to put a sleep and unable to wake up. Do I ask for minimal sedation where she is still conscious? Mom has periodontal.
Sure. So I do a lot of the surgeries out in San Francisco. I caught some of the question about C. difficile, which is usually when there's been a lot of antibiotics in the past and you develop a resistance, and that bacteria overtakes. So my guess is they don't want to keep putting her on antibiotics to patch the infection that's going on. And they need to take action by actually taking the infection out, because antibiotics only act as a Band-Aid. They don't actually cure the dental infection. I know there's a lot of fear when it comes to anesthesia, especially with dementia, fear they won't come out of it or be the same afterwards. To remember with dental is even a dental extraction is considered very minimally invasive compared to other types of surgeries. We're not cutting into the gut, releasing fat emboli into the bloodstream. So like with anything, there's risk benefit. But dental surgeries tend to be low invasiveness, and they can do a lighter type of sedation, even if it is general. They're all different types of anesthesia, whether it's IV or general. we always defer to the anesthesiologist and the primary care physician to make that call. Because even though you're scared of the general, maybe IV is actually more dangerous because they're in charge of their breathing when it's IV sedation. With general, the machines are in charge of their breathing. So there's risk benefits with everything. And it's just most important to defer to the experts, the anesthesiologist, for that question.
Thank you so much, Dr. Goodman. So I'm going to, there is a question regarding, it reads, how do you feel about UV toothbrush sanitizers? And a question regarding the correct toothbrushes. Oral-B indicator toothbrush, flat trim, compact head 30, the correct toothbrush to use.
You want to answer, Dr. Gupta?
So that UV light, I know that's become more popular recently to sanitize your toothbrush. I personally don't see the harm in it. But as long as you're changing your toothbrush every 3 months, if you feel like maybe your loved one should probably change their toothbrush every month, that's also no harm, but at minimum, at least every 3 months. And then the toothbrush, I think they wrote the right one. It was the number 30 Oral-B. I have to see exactly. I didn't get the full thing that was written down.
You'll get a link to that toothbrush.
Yeah.
So you don't have to memorize that. That's great if it's difficult to reach into the person's mouth or there's limited opening because it's a smaller head. Yeah.
Thank you. This might be a question for Julia, actually. So there's two questions. So my mom is in San Diego. Do you provide services there? And there's a question in terms of, are the services, is the cost out of pocket?
San Diego, we don't have an office in San Diego. We have had people, depending upon the need, travel, or we've traveled to them, but, we would want to know more about the case with respect to that. With respect to the individual pricing, I'll probably defer to Talia on that because she knows the pricing in both coasts better than I do. So I'll let her discuss the individual pricing and what's covered, what isn't covered, and all of that.
Yes, thank you, Julia. To Julia's point, considering we don't service San Diego directly at the moment, what we could do is provide you with that link to the Special Care Dentistry Association because we might have a partner from SCDA that can service your mom. And then just to address the question regarding fees and costs, we are a fee-for-service practice, which does mean we're not contracted with any insurance brokers or companies such as Medicare, Medicaid, Medi-Cal. So it would be an out-of-pocket cost, but we can certainly discuss all of that with anybody who is interested on an individual patient scale.
And one thing regarding the Medicare, that's typical with any dentist. So yes. Unfortunately, Medicare historically does not pay for anything from the head up. So they don't pay for dental, they don't pay for eye, they don't pay for ear. If you're in a hospital, sometimes they pay for some of the hospital services and anesthesia and all of that, but a direct house call. So it's really no different than if you come to our office. We charge the same fees as do, competitively with any other dentist. The only difference is we charge a travel fee to get us and our equipment to the home. And that's a pass along fee based on mileage or an Uber ride in New York City. It's unfortunate. The only people with Medicare over 65 that have some dental coverage are Medicare Advantage programs, and they're nominal and you have to be in network. And to be honest with you, most people don't find it covering enough, maybe $1,000 if at all, but you have to go to the dentist and take someone out. So we like to say prevention and doing this saves time and effort. And when anyone is traveling to and from a dentist, there's always risk. Transfers always have risks. So, and the time it takes to have somebody go with them. So that's why coming to the house is one of the hallmarks of our business.
you so much. Thank you. So there were questions regarding the recording. Please know that the information shared today, you will receive the slide deck in addition to the resources that Dr. Gupta and Dr. Goodman shared. Please know again that you can reach out to the Alzheimer's Association at our 24/7 helpline at 800-272-3900. We have chapters across the country. So we thank you again for joining us. So before we head out, I'm going to share my screen one last time. We want to invite you to the next Ask the Experts program that we are hosting in May in celebration of Asian American, Native Hawaiian, and Pacific Islander Heritage Month. So next month, Friday, May 30th, from 1 p.m. to 2 p.m., our guest speaker, Dr. Vivian Chung Wang from NYU, will be presenting on nutrition for a healthier mind. Again, that program is on Zoom, Friday, May 30th, from 1 p.m. to 2 p.m. Eastern Standard Time. So please know that you will receive more information on that program, as well as all of the information that was covered today. So again, we thank Dr. Gupta, Dr. Goodman, Talia. We thank you, Julia, for your continued commitment to serving our caregivers and our community. And again, we look forward to continue working with everyone here. Thank you, Claire from the California chapter. So please know that regardless of where you're tuning in from, you will hear from us next week.
Thank you all.
Thanks, everybody.
you.